we are still digesting the data about the PD-1 plus LAG-3. So this is, of course, interesting data that come from ASCO. And of course, we are all still digesting that, adding more information on that. But I guess one of the highlights, definitely from the melanoma perspective at this ESMO 2021, was the adjuvant Pembrolizumab in the stage 2, high-risk stage 2 patients. So brilliant presentation by Jason Luke. And I guess it will most likely change the way we treat those patients. And I just want to highlight probably two things. Okay, why, medically speaking, is so important? Well, first, because the high risk, so stage 2B and 2C, that we know that the recurrence-free survival is, in fact, as bad as the ones that we see for stage 3A and 3B. And for those, we give adjuvant treatment. So it makes total sense that we can consider the same management for those high-risk stage 2. So that makes sense. Makes sense that we have a positive trial and a positive result, which is fascinating. Some comments about this. Early days, of course, we need more mature data, not only in terms of follow-up, but ideally we'll have like survival data. Of course, it will take a long time. And now it opens a lot of other questions and more financial questions, which as a clinician, I don't really like to go there, but I think it opens some questions regarding approvals in different countries. So there is no question that it's a positive study. Patients will benefit from that. I think from a clinical perspective, there is no question. Still, few things to be addressed along the way. Need more mature data, follow-up, ideal survival data. And also that trial answers an interesting question that a previous study in stage 3 did, which is patients that recurred and can cross over and have Pembro later on. That's a very interesting question that it's not fully answered yet. Like, is it the same to treat early on or later on? Has been an old question, very hard to address and fully answer. But of course, keeping in mind those questions and of course trying to answer those questions, it's a positive result, it's a great trial, and it's great for patients. Moving on to apply that to our patients, depending in which country we are, it might take different time to be to have that available to discuss with the patients and offer to the patients. So it's always this limbo between the data is presented and then until the time that is available in different countries. That is going to be challenging. Interesting, but definitely challenging a period, because as clinicians, we know that we have something that is good for our patients, but we might not have that available up front for them. So we have to manage the best way we know. But that would be my highlight for ESMO this year, definitely.